My thanks to the Ministry and also Department of Justice and to invite me, and not only invite me but also to discuss about this important topic on mental health. I think which is so important, and this is what, and I must thank Ministry of Health also, those who nominated my name. So this topic is very important, I think, and the whole the theme of today's discussion, because I have participated in many such government activities for many years now. Mental health and access to justice. In fact, I may also tell you, I have taken few lecture NHRC also, where I talk about mental health and with the human rights and so on. And this whole theme, as such, mental health and access to justice, is so appropriate and so important in today's context, bridging law, care, and human dignity, which is very, very important in the context of mental health. And the topic which has been assigned to me is integrating mental health into primary care, healthcare, and government strategies and best practice. So this I will talk briefly just to take you on this particular area. So first of all, always I start with why we need to know about mental illness. I think, and all I believe that we never had to had a COVID to know the importance of mental health and mental illness. I think mental health was anyway important, but after COVID, I think so much importance of mental health has come up. You all may be aware, but it was always important, I think, and always we say the slogan "No health without mental health." I think that's a very, very important aspect. Now, one is that mental illness affects everyone, because it was a misconception that it only happens to adults and only in some class of people. It's not so. It happens to everyone, even children. Like I work with children, young population. Dr. Rachna is there, who also work with children. So it can affect children also. It can affect both the genders. We all know, and also third gender. Wherever they stay, either urban, rural. Sometimes people say that it's only the urban problem, not a rural problem, and which all are misconception. So it can affect anyone. That's a basic thing. That is what we need to know. And mental disorders are disabling and can affect all aspects of life. Now, this is also very important what WHO has taken the study out of 10, all disabling condition. Mental disorders comes in top two, top three. Depression is one of the disabling condition all over the world, including our country. So it is highly disabling condition. We all know that. And there is a close association of mental disorder with chronic condition, because so much talk is about NCD now. The world is talking about non-communicable disease like diabetes, hypertension, cardiac illness, and so on. So there is a almost 30% association is there with non-communicable disease, injury, and violence, and even maternal and child health conditions. So there is overlap. There is a strong association of mental health problem, mental illness in these conditions. And also there is some time back the government of India has made a document, mental health and the macroeconomics, because we all know, even in our country, the studies which are done, it's a loss of $1 trillion. And there is a much evidence. If you ask me how it is done, the economic loss, because those who have mental disorders or mental illness, either they are absent from work, absenteeism is there, or even if they are present, they are the productive. If they have a problem, the productivity goes down, the efficiency goes down. So overall, it's loss to society and the nation also. And this is there all over the world, because that is why we need to think about mental disorders, mental health, because it has a link with the economics also of the nation. So that is why we need to talk and discuss. And of course, depression is number one cause of disability around the world, also in our country, which is highly disabling, which prevalence is almost 5% and more. So one can see that's very, very common condition. There is also in our country, you would have heard about many suicide or self-harm behavior which is there, which again is a serious concern also in our country, and a huge treatment gap is there. Now, treatment gap, what I mean here is, out of 100 people who have the illness, only 10 to 20% people they come for the treatment, or the treatment is there. there is a gap of almost 80 to 90%. So and these are for the number of reasons like stigma, services, lack of resources, and so on. So the gap is huge. No other condition will have such a huge treatment gap. So, and of course, there is a shortage of mental health workforce. Now this was about mental health. Now, what is primary care? Since the topic says the integration of mental health in primary healthcare. Now, primary healthcare actually we have to understand this. It is a basically a essential healthcare. It's a essential healthcare which is universally accessible to people, individual. Like one can access easily, not only individual but also family in the community. It is there in the community there itself, and as close as possible where the person live or work. So that is what is and primary healthcare. Like example I can give, like in a rural area we have something known as primary health center, like which is in the close vicinity, like you don't have to travel to go to the big hospital. So that's a primary care, primary health center. Or even urban center, you have, let's say, a medical officer there, or there may be a general practitioner. So all those which are in the close vicinity, that is primary health care, which refers to the care which is based on the needs of the population. So basically the needs of the population, they take care of that. It's decentralized. I think that's a key thing about primary health care, and requires the active participation of the community and the family. So again, it's a community services, active participation. And PSC, primary health center, is the first point of contact on a individual. Now, primary care for mental health, also we need to understand this. WHO has given a model. Primary care for mental health, as defined by WHO, is fundamental but supported by other levels of care, which includes community based and hospital services. Like what we are working in the hospital based services, the community services where it is in the close vicinity there itself, in the place like community health center or district health center and so on. Of course, there could be informal services, or more importantly, there is a self care also to meet the full spectrum of mental health needs of the population. It's an essential component of any well functioning health system. When we talk of health system, it's an essential component. Other levels of care are secondary level. What we say, it's a where the primary care workers are turned for the referral, support, and supervision. When from primary care, they are referred to secondary care, or even tertiary care. Tertiary care, apex center like AIMS, or medical college and so on. So it's a different level. Like primary care is at the primary health center basic level, then they are referred to district hospital, that is a secondary level, and tertiary level is something like a bigger hospital. So basically it linkages to informal and community based services. Now this is the pyramid. If you can see, like just to give a glimpse, when we understand health, it's like a pyramid. Like the lowest one, where the most people have the service, that is a self care. Then of course there is informal community care, then the psychiatric care, then the top one is the long stay care, or the mental hospital, or the wards which are there in the hospital. So but you can see that cost increases when we go up the ladder, cost of the services. But it is important, when we talk of integration, we have to understand this pyramid, because we have to see there's a strong relationship between these. And of course, when we have to talk of integration of primary mental health care within the context of the overall healthcare system, and this is the overall healthcare system. Now the question comes, what is the reason for integrating mental health into primary care, which the topic is for today's discussion? We need to integrate the two, and basically the integration again becomes important, and that's a objective of WHO also. And where and basically it's WHO's most fundamental healthcare recommendation, and one is for the enhanced access, because the integration is needed into the primary care for the increased access, because many times the services are not accessible. Like say for example, if the services are only available in tertiary center, which is 500 kilometers away or 100 kilometers away, so people will not use it in that way. So that's one of the important reason, as you can see. Then of course there's a respect of human rights. I think again that's a very important, because if you provide services within the vicinity where the people do not have to travel for long distance, so again that's a important human right issue, which again is important. affordable. Again, primary care services, we all know people are reluctant to seek help in a big hospital because they think that so much, it will not be affordable to them. But within vicinity, with the primary care system, they are affordable. And of course, it's cost effective also. That's what we need to know, that they are cost effective in a way if they are provided in the primary care setting. So that is why, if you see, these are important reasons for integrating mental health into primary care. This is just to tell you, this is the study which, basically the burden of disease. We talk of the burden of disease internationally, but this was published in one of the important journal, Lancet. And also you can see that 1 in 7, they do have mental disorders. About 20 crore people, like, if you can see, 197 million are affected by the mental disorders and mental health problems. So depression, as we know, it's a one of the important condition, and depression and anxiety disorders, they form much of the disabling condition. This is our own part of the study where we found that there is a huge treatment gap, and for the mental disorders in our country as well. And this is based on our study. And of course, 95% was the treatment gap, but this was done about 15 years ago. But now it has reduced, but still it is substantial. And of course, 5.5% within 1 year were affected with diagnosable mental disorder. But again, I am saying this is the old study, but now the figures are about 10% or more. When we are talking of mental health integration into primary care. So the concept of primary health care was formally adopted by WHO, because that's important, by the declaration, as the preferred method for providing a comprehensive, universal, equitable, and affordable healthcare services. I think these are the key things which are important, and the ability to reduce stigma, improve access to care, reduce chronicity of mental illness, and improve social integration. So these are some of the one of the important model of mental health integration. What it recommends it countries to build or transform the mental health services to promote self-care. As we were saying in the pyramid, also self-care was at the bottom main thing. Build informal community care services, build community mental health services, and of course there has mental health service in general hospital, and to limit the reliance purely on the psychiatric hospital. Now, this is just to give you the model as such, and give you the kind of yeah, if you can see, for there are different connections are there in integrated mental health service in primary healthcare, like for better accessibility of mental health services, for improving human resources capacity, and more comprehensive care and follow up, reduce economic burden of the disease. You can see better treatment rates and quality comprehensive, better prevention and detection. So you can see with integration, we can achieve so many things. Reduce stigma and discrimination, better mental health and general health care outcome as such, better productivity, as we were saying, that has a link with economics also, better human right protection. So you can see that with the integration, we can achieve so many goals and objectives. So integration of service in mental health in primary care is the most viable, and closing the treatment gap and ensuring that people get mental health care what they need. So these are certain 10 principles of integrating mental health into primary care by WHO. I think just to give a glimpse that these are common principles which are there and which we all are aware of it. A patient must have access to essential psychotropic medication in primary care. In fact, that is what our government of India also does. We provide medicines at the primary care level. Integration is a process, not an event. We need to know this. Mental health services coordinator is crucial in that, because one coordinator who can coordinate the services. Collaboration are important with different bodies like government, non-government, NGOs, and so on. Financial and human resources are needed. Policy and plans need to be incorporated in primary care for mental health. Advocacy is required. There is, the services will be useless unless we advocate for that. People are not aware of it. We need to create awareness for that. We need to advocate for it. Adequate training of primary care worker is required for this. Primary care tasks must be limited and doable, and especially mental health professionals and facility must be available to support the primary care. What it means is, Everything cannot be there with the primary care. If there are some problems, they will be referred to the higher center. So that also the it should be available so that the proper referral are done. Okay, so these are some of the important government strategy and best practices. I think some of which I have been part of it with the Ministry of Health, like National Mental Health Program. India was one of the first low and middle income country to have this national mental health program, which was started in 1982. After this, we had district mental health program, with the model was in one of the district in Karnataka, Bellary, which again was, and now it's available in all districts of the country. And the huge budget is assigned for it. There is a manpower, there are other resources, there is a budget for training, for creating awareness, and so on. Manpower development scheme started in 2009. Basically, there was shortage of psychiatrists, clinical psychologists, psychiatric social work. So there were center of excellence were made, and currently we have 22 center of excellence in the country, other than AIMS and other big institute. And of course, there the funds were given to in medical college the psychiatry department, so that so this was a specific emphasis on manpower development scheme, which was started in 2009. Then of course there is a very important policy, that is a national mental health policy, which was released in 2014, and many such integration are mentioned in that. Basically the aims are to how we can provide services to all people. And of course we do have a national health policy also, where is the reference to mental health is also there. And we all know very important mental health act, which was earlier 1987, but the current one we have 2017 mental health care act, and rights of person with disability. Now here in mental health act, we just heard from the chair that there are important provisions are there. Like one of the important provision in chapter 5 is there, where the integration is mentioned, that integration of mental health in primary care, we will be training to the as a rights of a person. And so the mental health care will be at par with the physical health care, and so on. And there is also a duties of government, that is a chapter 6, where the training of all medical officer will be there for with regard to mental health services, and so on. So a lot of these are mentioned in the our mental health care act 2017. There are other initiatives also for the integration, of course the training, and maybe you can come to conclusion. Yeah, so training initiatives are important, and because we need to train doctors, TOTs, with medical doctors, psychologists, and so on. In fact, Government of India, Ministry of Health has undertaken, I have been part of few of this training program, which is important, and two, for the capacity building. This is also another model which we also published, that is in different sites, another model, they're integrating mental health into public health. Because lack of time, I'm not going to detail, but of course this was with the help of ministry, this was undertaken. This is the project which we are doing, which we have been part of it, which we have published. Anyone interested can see. This is integrated community and primary healthcare worker intervention to reduce stigma and improve management of common mental disorders like depression, anxiety in rural India. So whole protocol is there, which is basically talks about the integration. So to conclude, I think integration of mental health into primary care is of critical importance, because mental disorders are widespread, disabling, and closely linked with chronic condition. Yet India faces a massive treatment gap, and shortage of specialist integration is required to ensure universal, equitable, and affordable care, reduce the stigma, and make services accessible to community level. And this can be achieved by by few things, like strengthening primary health care, and health and wellness center, like sub centers have become health and wellness center. The government has a big plan, all the 2 lakh which are there in the country, to upgrade them. And again, there is a model, there is a guidelines are there to identify and treat, training frontline health workers for screening, counseling, referral, and so on, leveraging digital tool now which has come up, decision support system and telepsychiatry. Then there is a whole program, anti-stigma campaign also in the school, panchayats, and self-help groups. Embedding suicide prevention protocols are also important if we have to achieve this integration. So the combining policy framework, digital innovation, community engagement, right-based legislation, India can close the treatment gap and build a primary healthcare system that delivers accessible, dignified, which the today's theme is also, and holistic mental health care for all. With this, I will end here. Next, please. Yeah, my thank you slide. Yeah, thank you, everyone.